The British National Health Service (NHS), an analysis of its efficacy and comparison with German and American health systems. Introduction. Hello and welcome to our exciting and informative channel. This comprehensive analysis is going to examine whether the British National Health Service (NHS) provides what patients need versus what they want, its fitness for purpose, and how it compares with the German healthcare system. And then we shall compare it as well with the American healthcare system. In addition, we will explore the need for training more healthcare professionals, funding adequacy, demographic spending, and recommendations from health experts. Finally, we will do a deep dive of the best healthcare system globally and how other systems can learn from it. The British National Health Service (NHS). Overview of the NHS. The National Health Service (NHS) was established in 1948 for the purpose of providing healthcare to all UK residents based on need rather than their ability to pay. It is primarily funded through taxation, and it offers a dearth of services which include primary care, hospital care, mental health services, and more. NHS needs versus wants. Needs. The aim of the NHS is to provide necessary medical treatments and preventive care. It looks at prioritizing emergency care, treatment for chronic illnesses, vaccinations and screenings, maternity and child health services, mental health services. Wants. Patients' wants may sometimes go beyond their immediate health needs and can include shorter waiting times for elective procedures, more personalized and holistic care, greater access to advanced and experimental treatments, improved hospital amenities, fitness for purpose. Strengths. 1. Universal access. Every UK resident is entitled to free healthcare at the point of use. 2. Comprehensive coverage. The NHS covers a broad spectrum of health services. 3. Efficiency. The NHS is often cited as cost-effective, particularly when compared to other healthcare systems. Challenges. 1. Waiting times. The NHS has faced criticism for long waiting times for non-emergency treatments and specialist consultations. 2. Resource allocation. There are ongoing debates about whether the NHS adequately meets the needs of all demographics, particularly with the rising demand from an aging population. There is a school of thought regarding whether more resources should be diverted from an aging population and injected into children's services instead, particularly children and adolescent mental health services which need more input and maternity services. 3. Funding issues. Even though it is being publicly funded, the NHS more often than known operates under financial constraints. Funding and demographic spending. Funding adequacy. The NHS is primarily funded through general taxation. However, concerns about funding adequacy are persistent, especially given the increasing costs that come with healthcare advancements and an aging population. Pay. The healthcare professionals need to be paid more adequately, and the specialist fields need to be exactly that and given their rightful place on the various professional registers, and the healthcare professionals need to be paid for their specialisms. Demographics. Elderly. Did you know that according to demographics, the elderly population needs more intensive and frequent medical care, resulting in higher healthcare spending? For instance, it is reported that those aged 65 and over account for 44% of hospital admissions, but represent only 18% of the population. Children. While children also need significant healthcare resources, specifically for vaccinations and early development monitoring, their overall healthcare spending is lower compared to the elderly. This needs to change, and mental health services for children and adolescents needs a higher spend as soon as possible. Training needs for healthcare professionals. The UK, like many other countries, faces a shortage of healthcare professionals. The NHS has acknowledged the need for more doctors and nurses to meet increasing demand and ensure high-quality care. Competent and qualified NHS managers are required, and they need to monitor the scourge of bullying amongst the NHS professionals, in particular top-down bullying of staff, Plus, they need to monitor the healthcare staff to patient ratios more closely. The Health Minister's Department would be prudent to carry out forensic audits of the Integrated Care Board's IKE and how money is being spent, and pay particular attention to invoicing, and also to delve into the practice of senior managers, assistant directors, and directors who were once asked to leave employment returning as agency or contractors to the same or higher positions, as many are holding the NHS back due to lack of the correct training, skills, and experience, and it is not helping the NHS sustainability. They also would need to look into tendering and costs in the IKE and make this process more transparent, in particular staffing, namely which agencies are being given the tenders to staff the IKE, and also provision of services such as the IT systems being used by IKEs. It is not a good idea to stop the various NHS teams from recruiting and expecting the current staff to take on a heavier workload. This needs to be analyzed, and government needs to train more nurses and doctors. Comparison with the German and American health systems. The German health system. Overview. It is widely known that Germany operates a universal multi-payer healthcare system funded by statutory health insurance (SHI) and private health insurance (FI). It focuses on both public and private healthcare delivery. Strengths. 1. High accessibility. Patients have good access to healthcare services with short waiting times. 2. Comprehensive coverage. The system covers a wide range of services, including dental and mental health care. 3. Quality of care. Germany is known for its high standards in healthcare provision and outcomes. Challenges. 1. Cost. The German healthcare system is relatively expensive due to high standards and comprehensive coverage. 2. Complexity. The multi-payer system can be complex to navigate for both patients and providers. Training needs. Germany also faces a shortage of healthcare professionals, particularly in rural areas. Efforts are being made to increase the number of training positions for doctors and nurses. The American health system. Overview. The United States has a mixed healthcare system, combining public and private insurance. Significant public programs include Medicare and Medicaid. Strengths. 1. Advanced medical technology. The U.S. is a leader in medical research and technological advancements. 2. Specialized care. The country offers a wide range of specialized treatments and procedures. Challenges. 1. Access and affordability. The high cost of healthcare and insurance can limit access for many individuals. 2. Disparities. There are significant disparities in healthcare access and quality based on socioeconomic status and geographic location. Training needs. The USA faces a shortage of healthcare professionals, particularly in primary care. Efforts to expand medical education and training programs are ongoing. Comparison summary. Accessibility. Germany excels in accessibility, with shorter waiting times compared to the NHS. The USA has significant disparities in access. Quality. All three systems provide high-quality care. However, the USA leads in medical technology and specialized care. Cost. The NHS is the most cost-effective, while the USA system is the most expensive. Health system funding and demographic spending. NHS. Funding, primarily through taxation, facing financial constraints. Demographics. Higher spending on the elderly, with significant needs for both elderly and children. Germany. Funding. Combination of statutory and private insurance, well-funded but costly. Demographics. Balanced spending, with significant investments in both elderly care and preventive services for all ages. USA. Funding. Mixed public and private insurance, very high costs. Demographics. High spending on elderly through Medicare, significant disparities in funding and access for low-income populations. Best health systems in Africa. Leading countries. 1. South Africa, known for its relatively advanced healthcare infrastructure and medical training facilities. 2. Egypt offers a wide range of healthcare services and has made significant investments in healthcare improvements. 3. Rwanda has made remarkable progress in healthcare access and outcomes, particularly in maternal and child health. Expert opinions on healthcare systems. Britain. Sir Michael Marmot, who is a leading public health expert, stresses the need for addressing social determinants of health and making sure of equitable access to healthcare services. He advocates for a more integrated approach to healthcare delivery, focusing on prevention and community health. USA. Dr. Adil Gawande, who is a prominent surgeon and public health researcher, has highlighted the significance of improving healthcare delivery systems and addressing inefficiencies. He advocates for improved coordination of care and more emphasis on primary care to reduce overall healthcare costs and improve outcomes. Germany. Prof. Karl Lauterbach, who is a health policy expert, emphasizes the need for maintaining high-quality care while controlling costs. He perhaps would support the integration of digital health technologies and enhancing preventive care to improve the efficiency of the healthcare system. Africa. Dr. Agnes Binagwaho, former Rwandan Minister of Health, stressed the importance of universal health coverage and community-based healthcare strategies. She advocated for robust healthcare infrastructure and continuous training of healthcare professionals to improve health outcomes. Aftercare. Experts universally agree on the emphasizing the importance of aftercare in ensuring positive health outcomes. Effective aftercare should involve follow-up appointments to monitor the patient's recovery and also manage chronic conditions. Rehabilitation services which emphasize support recovery from surgeries or severe illnesses. Community support programs to give continuous assistance and resources for patients. Conclusion: best health system and lessons for others. Best health system. The German healthcare system is often regarded as one of the best in the world due to its high accessibility, comprehensive coverage, and high-quality care. It balances public and private healthcare provisions well and stresses preventive care. Learning from the best. 1. Accessibility. Other countries' healthcare systems should learn from Germany's emphasis on accessibility and shorter waiting times through the improvement of resource allocation and efficiency. 2. Comprehensive coverage, making sure there is a wide range of services, including preventive care and mental health services, may result better health outcomes. 3. Quality of care. Investing in healthcare infrastructure, training, and technology will definitely improve the overall quality of care. Recommendations for improvement. NHS, increase funding to take care of resource constraints, reduce waiting times, and increase investment in preventive care. USA, they could try to improve access and affordability through expanding public health programs and reducing healthcare costs through improved coordination and primary care. Germany should continue to balance high-quality care with cost control and look into healthcare professional shortages, especially in rural areas. Therefore, in adopting these strategies and shifting their emphasis to patient-centered care, healthcare systems worldwide may improve their effectiveness and ensure better health outcomes for all citizens. Conclusion. Thank you for joining us on this exhilarating journey, and we believe you have learned something valuable which you can share with others who may need this information. Press like, subscribe, and do feel free to comment. Hit the notification bell so you do not miss our next videos when we upload. Let us build this community so we can continue to help people find a balance and thrive.